when you hear the voices of the families that call or even the patient themselves calling, it's like out of almost desperation sometimes, like, I just need help. Dad just needs help. Mom, is in this position. What can you do? And, when I think back on just my own personal family experiences, I remember, my family dealing with a loved one having some cognitive impairment issues, and everything felt so transactional. And I've always told myself I want to take a more personalized approach.
All right, welcome to another episode of We Are Amada, and I have the legendary Halie Moore here with me.
Hi, guys.
Yes, from Covington, Louisiana.
Yes.
The owner, the proud owner, and by the way, really, really proud owner of Covington, Louisiana, because it took you a long time to get your business open.
It did. It took me 3 years. So kind of a backstory. We purchased the Amada franchise for Louisiana in December of 2021, and we got fully licensed in November of 2024.
That is a journey.
It has been a journey, but very well worth it. And I think it shows, the passion that we have for serving seniors in our community.
And you were a fast starter.
Yes, we did. We had a pretty quick start out of the gate. And I just think it's probably the area that we're in. There's such an immense need for healthcare. And also, too, I think a lot of it comes from just my background working with seniors and being able to have those right conversations with them about what the next step looks like and, what home care is. So
tell us a little bit about your background. What were you doing before Amada Senior Care?
Yeah, so I'll kind of go back to the very beginning. It's no one really understands this, and I always like to tell people they think I'm a nurse. They're like, you own a home care agency, you probably have a clinical background, you're probably a nurse. I'm not. I'm an accounting major by trade, which is always kind of a laughing joke because I don't have an accountant personality.
Yeah.
So I always love to tell this story. I worked in public accounting for about 6 months straight out of college, and my boss came to me one day and said, Halie, you're a great asset to the team. We love you, but accounting is not your
Really?
thing. We think that you need to pursue a job in sales.
Wow.
And it really kind of took
company?
me. It was just a small, privately owned company in very small town, like in Alexandria, Louisiana, actually.
Okay.
So not even in the Covington area. But I thought, sales, I don't know about that. And so I kind of started applying. I wanted to go into medical sales. And as you know, it's hard to kind of break in if you don't have a prior sales history.
Absolutely, yeah.
So I ended up doing several interviews and finally landed a job doing durable medical equipment and pharmaceutical.
Okay.
And so we did that. I did that for about 2 years, but it was geriatric focused.
Interesting.
And really kind of fell in love with the geriatric population at that point. Loved working with the seniors and their families. And at that time, I was working in a very rural market. And for me, just to see the difference that something as small as what a wheelchair or a hospital bed would bring to us, it was such a need for those families. And so to kind of see how it would change their lives, it was like it gave me purpose. And I always wanted more. I wanted to see that smile, I wanted to see that change. And I did that for 2 years. And then I actually moved into home health, and I did home health for about 10 years. So my background's always been in geriatric care. So I've been doing it since 2010, so about 15 years.
Wow.
Working in geriatric care.
So you're doing sales and you're in a clinical setting, no longer doing accounting.
No way.
Yeah, gone.
Yeah.
But what led you to wanting to start a business?
So when I worked in home health, it's always funny. So being in Louisiana, there's a lot of restrictions. And my husband always made comments like, Halie, maybe one day you should have your own home health agency because you're so, passionate about serving seniors. And I said, well, that's never going to happen because there's a home health moratorium in the state of Louisiana.
Right.
So we would have had to, purchase a prior already established agency. And there's a lot of clinical, stuff that goes into the actual home health piece of it. So when we had the opportunity and came across Amada, it's it was like a perfect fit. And it's not something that I ever really thought I saw myself doing, being an entrepreneur, moving into this space and into this position. But it's like it became a reality. And it's like the more I learned about Amada and the people behind Amada and just the passion that you guys had for serving seniors in the home, I wanted to be a part of that. And so when I went through Discovery Day, I was sold. And then it's like the rest is history. Here we are. So I think for us, looking back on it and me waiting out for 3 years to be where I'm at today, it feels very surreal. It feels very, very surreal. And I couldn't ever see myself doing anything else at this point. This is where I want to be.
That's amazing. Now, we were talking a little bit before we started recording about the mix of your business. And tell us a little bit, because I know that you do a lot with veterans, and tell us why it is that it's so important to work with the veterans in our communities, and how do we help them?
Yeah, absolutely. So when we meet with any family, we always run through resources of what's available to them. And that's one of my first questions. First and foremost, do you have a long-term care insurance policy? Are you a veteran? Were you married to a veteran? We try to dig deep and try to get all of those questions answered so that we can tailor our conversation to see where we can meet them. And I do think, in South Louisiana, we have a very large veteran population. We worked very closely trying to get licensed to be able to have an NPI number to be able to serve those veterans for that community care network benefit. And so as we are new, into that portal and just getting that license, it's important for me to be able to explain and educate the families that are veterans. Most of them don't even know that this exists.
Yeah,
and
this is so crazy.
Yeah, it is. And it's like we try to educate from the ground up of like where those benefits are, where those resources are, and how can we tap into them. And so we just kind of do the groundwork for them. And I think the most important thing is, since we don't have direct access to some of these social workers and case managers, being able to be in the community and advocate for those families and advocate for those veterans to tap into those benefits is the most important thing.
Yeah.
And so, we try to work very closely with the veteran or their direct family member to help them even get enrolled in VA healthcare if they've never, had access to that before.
And what I understand is so many veterans. And I think Heidi, who is the resident expert here at Amada Senior Care on veterans, she was saying that almost like half of veterans are not registered with the VA.
I can tell you based off of just his history, and I'm still new into the business, but the families that we talk to, there are so many. I mean, I would say that that's an accurate statistic because you start talking to them, they served, and then they went out and got jobs, and then they just enrolled in actual commercial insurance, and they never tapped into the, the VA healthcare side. And they sometimes don't realize that it is such a benefit. The other thing that we try to educate on, sometimes I get this question with families, well, if I enroll in VA healthcare, do I have to leave my primary care physician?
Right.
No.
Yeah.
It's literally just an added benefit. So it's like you're still going to be able to see. It's patient choice.
And nothing's changing.
Yeah. You're just getting that added benefit where we're going to be able to provide a caregiver in the home for those established hours per week. And so I'll kind of talk a little bit about that. But when you go through the CCN benefit through the VA, that social worker, case manager, primary care physician, they allocate so many hours per week for our agency to come in and serve.
Right.
And be able to provide that home health aide or that CNA in the home. And so, before they even go into that first primary care appointment, we really educate the families on what's going on with mom or dad. What's happening? What's the underlying diagnosis? What are some of the activities of daily living that he really needs help with or she really needs help with? And we try to paint a picture. We help the family to paint a picture, an accurate story to be able to provide to that physician, because that's how they're going to be able to access more of that benefit.
And see I love what you're explaining here, because if you are looking at Amada Senior Care and some of this is like, well, that's a lot of stuff. That's the point we're trying to make, that families have no clue how to figure this out. So it's not just that we are out there providing caregivers, right? A lot of people think of business just somebody calls and says, I need a caregiver. And you go, okay, great. I bill this much. And they go, okay, great. It's so much more than that.
It's so much more than that. And I really do try to take a more personalized approach. I think it's important because when you hear the voices of the families that call or even the patient themselves calling, it's like out of almost desperation sometimes, like, I just need help. Dad just needs help. Mom, is in this position. What can you do? And, when I think back on just my own personal family experiences, I remember, my family dealing with a loved one having some cognitive impairment issues, and everything felt so transactional. And I've always told myself I want to take a more personalized approach. And so we don't dig directly into those answers. Like, I kind of cut families off sometimes, and I'm like, let's just have a conversation before we start talking about rates or minimum hours. Because I think, they're doing their research. They're just trying to get quick answers. And I do understand that, and I want to be mindful of that. But at the same time, I also want them to understand what we bring to the table as an agency.
Yeah, that's such a big part of what the business really is that advocacy. And it's been really cool. We've done so many interviews while we were here at the conference, and everyone is really hitting hard on that, on just this part of advocacy. The other thing that you're doing a lot of is long-term care insurance advocacy. So you talked about the VA side. Tell us a little bit about how important it is to help families with their long-term care insurance benefits.
Can I tell you a really wild story about long-term care?
Yes.
Okay. So this gets me super excited.
And maybe for somebody who, and Infuse is, a lot of people don't even know what long-term care insurance is.
Right.
So.
Absolutely. So kind of to your point, I don't think that long-term care insurance is really talked about a lot.
No.
And so sometimes when I bring it up, it's like, I can kind of see the hesitation with like social workers or case managers, like, why are you coming here talking about long-term care insurance? And so it's like, but I want to be the person that they come to ask those questions. But I had received a referral from one of our just outpatient rehab facilities. Patient was, it was a male client, just didn't have a lot of like resources as far as family resources, like never married, he was a single male. He had a pretty severe episode that landed him in the hospital, still really kind of undiagnosed. And he chose a private caregiver. And there's nothing wrong with that, but that this particular patient had a couple of long-term care insurance policies.
Now, when you say a private caregiver, like, what do you mean?
Just not through an agency.
Just somebody kind of under the table.
Yeah, someone that was highly recommended. And there's nothing wrong with that, because for some families, that absolutely works.
Sure. Yeah.
But in this case, this particular person knew nothing about long-term care insurance. And this guy was paying for care for like 5 months. He was just paying this caregiver. And instead of filling out those independent contractor invoices through his long-term care policy, he wasn't able to get or access any of those benefits. He had been paying
premiums for long-term care insurance probably for 30 years, but didn't know he had it?
He knew he had the policies, but that particular caregiver, because she wasn't working for an agency and she didn't know.
Oh, I see what you mean. Yeah.
He wasn't able to activate his policy. And so he was on services with her for like 5 months, and he had a 90-day elimination period.
Oh, yeah.
So one of the rehabs had sent the patient over to our agency, and I just had a conversation with him, and I said, let's do a policy review. And, he kind of looked at me like, what does that even mean? Like, what are you coming to do? Like, are you an insurance expert? And I'm like, no. So what we did is we sat down, and come to find out, he had not one but 2 long-term care policies.
Oh my gosh.
Yes. So one with Genworth and one with Unum. And it was very great policies. And so what we were able to do was we were able to just walk him through what that process was to get those claims activated so that he could continue to have a caregiver in the home. Yeah. And so it was really interesting, because after going through the policies, we worked hand in hand with his private caregiver. We were able to have her fill out those independent invoices, and he was back paid through his Genworth policy.
No way, for those 6 months or 5 months?
Which was incredible.
Wow,
and so he was
fortune.
like, so he was on cloud 9, like, oh my gosh, like, you came in, you helped us get this activated. We worked through our elimination period with the past care that they had. So it was an incredible opportunity for me to kind of witness that. And I always tell people, that is the difference that we make to be able to use that story when we're working with families.
That's
and
the kind of
importance
story
of long-term care.
Nobody has that story.
It's incredible.
Like home care companies just don't do this.
Right.
You know, that is so cool.
It was really
It's not
cool.
just couch money. You found this gentleman a crazy amount of money, and for the future too.
Two policies. And what's so wonderful is he's doing really well. Like, he's doing really well from his episode that he had.
Wow.
He still needs help, but it's not a high level of care.
Yeah.
And so, we're still there to kind of help be there for him and know that he's still going to have these funds available if there is a decline in care. Okay,
so what about, and I forgot to ask you this before we started recording, placements. Are you seeing placements at all?
So
and placement, I'm sorry. So placements is we do home care, but then also if home care is not ideal, then maybe you can help the family find an assisted living, a boarding care. What do you, in Louisiana, the term boarding care, do you guys use that word in Louisiana?
We do not. That just took
Isn't
me
that
by
interesting?
surprise. Yeah, I was like, what's boarding care?
In California, if it's a single family home, and in California there's a ton of these, entrepreneurs are just getting single family homes and they have 5 or 6 seniors in the home and they're licensed. And they can take care of those 5 seniors or 6. They're called boarding cares. They're like tiny assisted living.
So they don't call them boarding care, but there are a couple of like independent homes that basically they have the rooms segregated.
Yeah,
privately.
Exactly.
So it's very. I think it must be.
What do you call that in Louisiana?
They call them like assisted living.
It's just under the term assisted living.
Yes.
No way.
Which is interesting. There are a couple in Louisiana. So I think it's like such a different market. So we've talked to several other, franchise partners since we've been here, and placements are very different where we are because there are assisted living and independent living facilities. There's not a plethora of them. And so there's a lot of waiting list.
Is there really?
Yes.
So if you want to go to assisted living, you might very well be on a waiting list.
You absolutely maybe.
Wow.
And we've worked with several families. And so really what I've done is I've, introduced myself to, these facilities to let them know that we are in the community. And when we work with a family, we typically just tell them up front, yes, we do home care, but we also do placement. So if there is a higher level of care or you are looking, to make a move into a facility setting, we will help to facilitate that.
Yeah.
And just really based off of the criteria that they give to us. Like, we've done our research, we've done our due diligence. So I've only been able to help 2 families with placement. And the way that I did it was I really just asked, do you have a preference of facility, first and foremost? And so they would tell me like first, second, third preference.
Yeah.
And so I would just go get the numbers, do my due diligence with those directors and just make sure I have everything lined out. And then I just put a proposal together and just gave it to the family and they were able to choose that way. So it was very much that type of approach, just kind of laying everything out in front of them. And if, they requested us to do a tour with that facility, happy to go on that tour and help facilitate that. But I just think Louisiana is a little bit more of a different market for placements. From some of the conversations that I've seen here.
What's cool about Halie is the only Amada Senior Care in Louisiana. Like, you are the one. You're the explorer. You're Lewis and Clark. You're the first.
I feel like Lewis and Clark most days.
Yeah, it is. Because I think it's such a unique state.
It is.
With unique and you were talking about how uniquely amazing it is and how uniquely challenging it is. Like, it's really cool.
It is really cool. And I'm a native to Louisiana, so born and raised.
Yeah.
Not in Covington, but I'm from the central part of the state. And we moved down to like the North Shore of New Orleans area in 2019, right prior to COVID.
Yeah.
Fun times. Newborn baby, first child, like no job. Like it was great times.
That's pretty wild, yeah.
Yeah, like the COVID stories. Like that's my COVID story.
That's the COVID story, yeah.
And then, the next year is when we bought into Amada. But I will tell you, like, the area has been phenomenal. There really is such a need. And I think, like, it's because Louisiana in general is just a rural area. Like, the whole state is rural. You have your little pockets. And I think a lot of the times we start to see patients in these rural pockets that really need care.
Yeah.
And it's like those are the families that we're able to work so well with and like give them those resources. So it's very, very important. But there's such a need in the community as we like kind of use the term silver tsunami. There is a silver tsunami, in Louisiana and in this population. And it feels incredible for us to be able to serve that population.
So here's what's interesting too is I all the time have folks reaching out and we talk about how one client can potentially be paying you $5,000, $10,000, $15,000, $20,000 a month. And a lot of times people stop and they go, whoa, that's crazy. Nobody can afford that. I'll have like 3 clients. And then some people go, well, Marcos, that's because you're in Orange County, California. Like I'm in whatever, right?
Covington, Louisiana.
I'm in Covington, Louisiana.
Yeah.
No one's going to pay that here. And we try to explain, and I talk, well, you understand this is not a luxury and all that. But so it's cool listening from you that you've grown very quickly. So talk about, for those who are like, no way, people aren't paying this. What is your experience?
People are paying it. That's like my fast answer. So it's interesting. I think for me in the beginning, I kind of had that mindset.
Yeah.
Like,
sure.
Here we are in Louisiana.
Sense, right? Yeah.
Like, is this actually going to work? Right. I think COVID, as everyone says, really changed a lot of people's perspectives because I think that was kind of a push of let's stay at home let's get
home is safe.
And let's get care at home, And so I do feel like the dynamic has changed a bit. But what's interesting is some of the conversations that I have, I think in the beginning for me, and this is possibly like just small-minded, small-town mentality, right? Like born and raised, native Louisiana. I was like, I'm going to put a price out there and families are going to literally take off running like they're running a marathon. Like that right. That was me in my head. And so it's the opposite. So I think when you start to talk to families, they're like, this is a lot of work for a caregiver. Because they are doing it.
They're doing it.
And it's the burnout.
And they're exhausted.
They're so tired. Caregiver burnout is a real thing. And like I tell caregivers this and I tell our families this, caregiving is the hardest job in America.
Yeah.
And it's because it's not just a physical issue, it's an emotional issue, right? It's an emotional drainage problem. You're so tired. You're physically tired. It's mental.
Yeah.
So it's a lot that goes on with caregiving. And so I think when families come to us and they see what they've been dealing with and we put a rate out there, they're like, this is doable.
Yeah.
And in a lot of cases when they're not ready for that facility setting, it is so much more affordable than putting them in that facility when they don't need that extended level of care. And so, we try to work closely with them on minimum hours. That's a thing that I think we've had a lot of success with. We don't want them to just feel like they're paying for care for someone to just sit there and look at this gets asked to me all the time. Is somebody just going to come in and sit and look at my mom and she's going to have to eat her breakfast with a caregiver staring at her? And I'm like, no, guys, they're
a real human being.
Absolutely. And so I think in their minds, they want to make sure that they're being mindful about the financial side of it. But I think when you start telling them, we're going to have a caregiver coming in here 3 days a week, 4 hours at a time, what's the hardest part of the day for you? And
that's awesome.
And when you talk to them like that, they're like, it's the evening. I'm coming home. I'm exhausted. They're having an episode. They're starting to have some sundowners. It would be so nice to have a caregiver in here from 5 to 9. Absolutely. Let's see what that does. Let's put them in there. Let's start with Monday, Wednesday, Friday, 5 to 9 and kind of see if we can get them on a routine and a regimented schedule. And if that starts to change your life, and what always happens, we start low and they end up building a bigger schedule because they see the benefit and that value that it's bringing to their family. And so so thinking back on the rates, it's like, I really do encourage people, if you have questions about home care, you have questions about pricing, let's chat through that, because I think people are really surprised to see that it's actually not as expensive as what I think they're thinking it is.
Right.
So it's definitely a conversation to have.
That's awesome. So you've been open for
I'm on month 10.
Month 10.
Yay!
That is crazy.
Yeah.
As an entrepreneur, for everyone who's watching this, is only here because they are in your seat 10 months ago. Like they are trying to decide to go get another job, stay at the job, or start a business.
Start the business.
That's start a business.
Start the business. Don't be scared. I am and this is such a real answer. It was terrifying.
Yeah.
And you know what was the most terrifying? When I sat and waited for a license for 3 years, thinking that it wasn't ever going to be a reality for me.
That's scary.
That was the scary part.
Yeah.
It's like I was so excited and so invested in Amada, and I couldn't wait to be part of the Amada family.
Mm-hmm.
And for me, when that reality almost got pulled away because of a licensing issue, it was like, what am I going to do with my life? Like, this is what I want to do with my life.
Yeah.
And so I think, don't be scared. Like, jump all in, go all in, just do it. It is so worth it. And every single day, I don't care whether you convert a client or you don't convert a client, you're touching a family. And if you're not touching a family, you're touching a caregiver's life. And that is what keeps me going.
Well, you heard it here from Halie.
Absolutely, guys.
So we have an 80s party tonight.
I can't wait. Rock and roll.
Did you bring your 80s outfit?
I didn't.
Yeah, me either.
I also didn't bring my ball gown for last night either.
What'd you wear?
I'm not saying on this podcast. I was really upset with Matt Smith. You can tell him that later.
I will. I think some of those announcements come out a little late.
Like 2 days prior for departure? Yeah, very
that's
late.
Not enough time.
It's not enough time for outfit planning. And we're females.
We'll
I mean, come on. We've got to get it together. We need like all the entire planning.
I was wearing this last night.
Uh-huh.
It was another shirt, not the same shirt. And I for us, I can just find a button shirt and throw it on, and I'm dressed up.
Yeah.
So.
Well, I had a button shirt, but like I didn't get the cocktail attire menu, So yeah, it was fun times. Matt Smith, just tell him.
There you go, Matt.
I'm coming for him.
Yeah. Well, hey, thank you so much for joining us. Halie, thank you for everything that you do, and congratulations on your success in just a short 10-month stint. Amazing.
Yeah, it's very exciting times. Thank you so much.
Yep. All right. And if you're interested in Amada Senior Care, that's probably why you're here on this podcast, and you know where to find us. Just, reach out. Thank you so much for being with us. See you on the next episode.